Okay, so now we're gonna put on sterile gloves. I'm gonna use some hand sanitizer. Make sure your hands are nice and clean. If you have any visible debris on your hands, that's when you use soap and water. Hand sanitizer is just fine. That's what hospitals do. Okay, make sure it's nice and dry so your gloves will go on. Now we have the sterile gloves, just took it out of the packaging. Mine are non-latex. So when you're putting on sterile gloves, this part that's going to be on the inside you can touch. So you're going to pick that up, and I'm not touching the rest of the glove. See, I'm only touching here. Stop at that point. You have one sterile glove on. If there's any masks or anything that you need to put on, do that before you put your sterile gloves on, because once the sterile gloves on, you only touch other sterile things. So now, the way that you put on a set of sterile gloves, you actually slide your hand in the cuff here, okay, so you can get the glove all the way on, and you're going to slide this. Now they are left and right, so make sure you have the right ones. And if you have it in the cuff like that, I never had to touch my hand, and then I'm just going to pull the edge of it down and pull the edge of this one down. That's sterile gloves, okay? Now we're going to finish setting up the motor. Make sure the tubing, nothing's going to fall off. Here's the end of it. It's going to go right there. Now here, we're going to open that, and we're going to select, this one comes with a lot of different tubing. I'm going to use the single end. This has two ends. We don't really use that, so just set it aside. So now we take out the tubing. Careful not to drop it. Try to touch it as little as possible, particularly on the end that's going to be in the mouth. So you just set that down there, and we'll open this part of the tubing as well. Okay. Now this little wheel will cinch off the tubing. So if it's up, that's going to allow liquid to flow through. You don't want it to flow through right away, so you're going to close it down. We're going to place this end of the tubing, so this will end up going into the saline, and you want it to flow from here out. That's the same for all implant motors. So you have this little section here that you slide in, kind of stretch it a little bit, and hooks in there. Same thing for other motors, it just looks a little different. Close it down. Now you have this little piece here on this particular set of tubing, and we're just going to connect it like so. And right now it's closed, and then to open it, you're just going to turn this little knob, and it's going to allow the saline to flow through. Okay, and then we can put the tip on here. And this little edge, this is the irrigating. You can see that. And we're going to plug this in right there. That's an external irrigation. It's going to go shoot at the drill while you're drilling, but it's not going through. Sometimes they go through the drill. That takes a special type of drill. And then there's these little clips so that the hosing doesn't get, or the tubing doesn't get in your way. Usually that is enough to keep it tidy. If you need more, you can do more if there's more clips. There's a couple more. So I'm going to set that down. At this point now, I've done everything I need to do with my sterile gloves. This is all ready to go. I still have to connect this. For this part, this end of the tubing and the saline bag, you do not need to have gloves on. I still have my sterile gloves on, so I'm going to keep them on just to keep everything nice and clean. I'm actually going to slide this off, turn it upside down, and I'm going to take the end of this off. Okay, just came right, pull it off. Don't touch in there. And now you have this end of the tubing. I'm going to take the cap off. It's important that you not touch this. That needs to stay sterile as well. And that's actually going to insert into the bag. It takes a little bit of pressure to get it in there. And you just need it to poke up in there like that. And you hang it. And the last step, now that this is in here, it's going to create pressure and not let it drip. So now you can release the valve. And it's all set up.